Opus Biological offers a wide variety of treatments for knee osteoarthritis, and those treatments actually fit onto a spectrum. You start with simple things like losing weight and good physiotherapy, and then you augment that with different treatments that may be supplements, that may be pain relief, but also it may be some injection therapies. And Opus Biological believes in some of the natural healing effects of our body's own cells. And we use treatments like platelet-rich plasma and stem cell therapy to help people with knee osteoarthritis. Knee injuries are actually one of the most common injuries in high-profile elite sportsmen and women because of the amount of load and intensity those athletes actually endure in training for and competing in their individual sports. The amount of forces that go through the knee joint can be absolutely incredible in someone who is, for example, chasing down a football into the far corner of a pitch and having to decelerate at the very, very last moment in order to win that ball. That puts their knee or knees under huge amounts of stress, and we are not naturally built for that particular type of movement. So therefore, they are more likely to endure an injury. It's widely recognized that there are quite a few main causes of osteoarthritis in general, but primarily of knee osteoarthritis. We know that as we get older, as we age, we are more likely to get osteoarthritis. And because the knee is one of the larger joints in the body and there's a lot of biomechanical stresses that go through that joint, it is then more likely to get osteoarthritis. We also know that joint injury, so a traumatic injury to the knee, for example, is more likely to precipitate someone to have knee osteoarthritis later in their life. The ever-growing trend of increased body weight leading to obesity has been shown to play a huge part in people developing osteoarthritis of their knees. There is also a good amount of evidence that there is a part for genetics to play in the causation of osteoarthritis. And we know that some people are predisposed to knee osteoarthritis because of some anatomical differences that they may have to another person. So some changes within their hips, some changes within the bones in their lower limbs that may predispose them to getting osteoarthritis of the knees at later stages in their life. Lastly, we also know that if you're female, you're more likely to develop osteoarthritis and osteoarthritis of the knees than you are if you are male. If you leave knee osteoarthritis untreated, the likelihood is that the two most common reasons for actually seeing a doctor because of osteoarthritis will become more and more debilitating. So the first one is pain. Most people with knee osteoarthritis end up seeing a doctor because they have pain, and that pain is likely to get worse and worse over time if left untreated. The second reason why people come to see me is because they have a functional deficit of some sort, where either they cannot go for a walk without having pain, or they cannot perform a particular physical activity or their sport of choice because of a lack of function. That may be because they're unable to flex at the knee, unable to extend at the knee, or they're unable to pivot or rotate because of pain and some sort of anatomical change of the knee itself.